The results that have come back from our case yesterday tell us two things. First, that we are dealing with the Delta variant. The second thing it tells us is that it has linked the current genome sequencing of cases in the New South Wales outbreak. Our case has originated in Australia.
Further to the 5 cases reported earlier today, there are now a further 2 cases of Covid-19 to report in the community, our total now being 7 cases, all of whom are in the process of being transferred safely to the Auckland quarantine facility under strict infection prevention control procedures. Our first case, we will call Case A, that was announced yesterday. The other 4 cases announced earlier today include a work colleague of our original case, that's a 20-year-old male. There are 3 flatmates of that case, a 21-year-old female who is a fully vaccinated health professional that works at Auckland City Hospital and has been working in recent days. And as you'll be aware, there are measures underway to respond to that. There is a 25-year-old female teacher from an Auckland high school, that is Avondale College, and that college has been contacted, and the community will be receiving specific information about what to do to follow up testing and isolation, of course, for anyone who may have been in contact with that person. And the other flatmate is a 29-year-old male. There are 2 further cases that I'm just announcing, a 21-year-old female and a 19-year-old male, both of whom live in Auckland, and both who are linked to the current cases as friends, and who have spent time with one or other of those other cases. So in total, we have these 7 cases that are all linked. We are, of course, as I mentioned, concerned about the healthcare worker who worked 4 shifts while unknowingly potentially infectious. Auckland City Hospital was onto this last evening and took immediate actions in response, including preventing unnecessary movement of staff between wards, extensive testing of staff and of patients on the ward where this person worked, and of course preventing staff members who worked the same shift from coming into work, and they are isolating and being tested. The wife of our original case, as reported yesterday, who is fully vaccinated, has returned a second negative test at this point. On locations of interest, as I said, most of the cases identified so far are in their 20s. They've been out and about a lot, and I'm flagging that there will be large numbers of locations of interest. It is very important that everybody keeps an eye on these. There are 2 locations of interest I don't have the details on, but I want to signal these locations because they are important and they have just come to our notice. One is the Auckland Central Church of Christ in Freeman, that meets in Freeman's Bay from this last Sunday. So please look out for the time that you may have been there if you've been at that location. And the other is the Sky City Casino. I understand that was Saturday evening, perhaps early hours of Sunday morning. Again, if you were in either of those locations, look out. But I'm asking everybody to regularly check the locations of interest that will be updated as more information comes to hand.
So far, as you will have heard from Dr. Bloomfield, our contact tracers are reporting that when they are calling people who have been exposed, they are at home. I need everyone to think about what it would be like to receive that call. If you do, we need you to be at home, not out putting others at risk. We very unfortunately need only to look at New South Wales, who today have reported 633 cases. 92 were active in the community while infected. Level 4 restrictions are there to protect everyone and to make this lockdown as short as possible. For our essential workers, it is really critical that if you are sick, you stay home and that you get a test. And we will be making sure that we highlight this message to your employers also, so they can support you to do just that. Let me come then to decisions that are being made to provide extra protection for those who are working during Level 4. From 11:50 p.m. tonight, it will be mandatory for everyone aged 12 and over to wear a mask when they are visiting any of the essential services that are currently open, including supermarkets, pharmacies and service stations. It will also be a requirement for staff who work in those places to wear a mask also. This is about ensuring those workers are protected and ensuring those who visit them are too. As you'll know, it's already a requirement to wear a mask on public transport and planes, and that will now include places like bus terminals and also taxis. Simply put, at level 4, if you're in a place that is allowed to be open to provide services to people or transport, you must wear a mask. Some vaccination in limited sites will restart this afternoon. The most important message is that from 8 a.m. tomorrow, the vaccination program will resume throughout New Zealand. This will look a bit different though. Vaccination sites will be operating under Alert Level 4 conditions, and that means in some cases they won't necessarily have as many people coming through as they may have prior. That is to enable social distancing and safety. If you're one of the bookings that we need to move to ensure that we have a bit more space, you will receive notification. Otherwise, the message is simple. If you're booked for a vaccine tomorrow or the next day, and you haven't heard anything, please go. As you can hear, for the most part, we're intending to continue our rollout as planned. That means continuing to open up age bands for bookings. So, from today, as we had previously planned, those aged 40 plus can visit bookmyvaccine.co.nz to make their bookings. And if you're in that group, I encourage you to do so. That's Book My Vaccine. Finally, one of the questions I've been asked in recent times is, do vaccines make a difference? The answer is yes, an enormous one. To put it bluntly, if you've had the vaccine, you are less likely to catch COVID-19 and much less likely to get sick or die if you do. In fact, the risk of infection, according to the CDC, is reduced threefold in vaccinated people. But a few people do still get infected. We call those breakthrough infections. And people with breakthrough infections can transmit the virus. That's why we do still ask everyone to be cautious, no matter what your vaccine status is. To conclude, a reminder that we are asking people who might not have been at home when lockdown began to move to the place where they will be for the remainder of lockdown as soon as possible. If you have flights booked for today and tomorrow that you're no longer able to use, please cancel them. We've had reports from Air New Zealand of high numbers of no-shows for flights, which is understandable. Some of those bookings will be perhaps for holidays people won't be able to take or for work that they can't undertake. But by cancelling them, you enable someone who may need to get home to take that seat. Otherwise, I'll finish where I started with a thank you. When I asked Commissioner Costa on our call this morning how it was looking in terms of people doing the right thing, the response was pretty good. And Commissioner Costa will be here to speak to that shortly. But if we turn pretty good into great, that will end this outbreak more quickly. I know Delta is making people feel anxious and more afraid. And it is true that we will see more cases. But we can get on top of this, just like we have every other time, if we do it together.